Hello, everyone. My name is Jose Caballero, and I am a Senior Health Education Specialist for Solano County. Today, I am once again here with Dr. Christine Wu, the Deputy Health Officer and the Chief of Communicable Diseases for Solano County. Hi, Dr. Wu.
Hi, Jose.
So, we are again going to use this form to communicate the weekly update and practice social distancing. Today, Dr. Wu is going to give us a quick recap and then some health tips. Let me switch over to the dashboard.
Thanks, Jose. So as you guys can see, as of Friday, May 1st, May Day, we have now 266 total confirmed cases and 5 total deaths, all of whom had underlying health conditions. You may be concerned that, we are seeing so many new cases, the majority of which are from Vallejo. But in the past week, we have done over 1,500 new tests, which partially accounts for this sudden increase. And you may also be aware that we are dealing with an outbreak in Vallejo. What is reassuring, though, is that the number of hospitalizations remain relatively stable, and currently only 11, as you can see from the dashboard, of the 40 active cases are hospitalized. And you can look at the hospital impact. Our hospital ICU and ventilator capacity remain good. And additionally, public health also tracks the percent of positive rates based on the testing, and that has been stable as well.
Awesome. And just so that I can remind everyone, our dashboard is updated Monday through Friday by 4:30 p.m. So that is where you would get the latest numbers. Now, Dr. Wu, one of the questions that we've been hearing a lot is, when is our county going to reopen? Can you give us an
Yeah,
update?
so, first, I want to thank everyone again for doing their part, staying home, practicing physical distancing as much as possible whenever we're out doing any sort of activity. Um, that's been getting much harder as the weeks continue. And just in line with the state and the rest of the Bay Area, Solano County Public Health did extend our shelter at home orders through May 17th last week. And you may have heard Dr. Fauci, from the CDC describe how the reopening of the country should be thought of like as a small trickle, when you turn the faucet on, just go slowly. And even our own state governor, Governor Newsom, described thinking of like this as a dimmer switch, a light switch that you can slowly, increase. Um, just because, as effective as all of our efforts have been, if we move too fast to ease these restrictions now, the potential for exponential spread could have grave impacts and terrible impacts on the health and wellness of our residents as well as the economy, and really waste the efforts that we have made with these shelter at home orders.
Okay. So really this is our new normal, is to be on this dimmer switch where, we're not going to go completely back to unsocial distancing, right? We are going to continue to practice social distancing so that we can continue to flatten the curve. And as we ease restrictions, we still have to be mindful of those things.
Yes.
Um, the other thing that people have asked is, does the data support Solano County extending the health order? What can you tell me about that?
Well, so, the reason why we extended the health orders is that, in reality is that we are still in the early stages of fighting this pandemic. Every day we are learning more about this virus. And the truth is, this virus spreads easily. The testing capacity is still limited, though we are really rapidly, expanding the testing capacity. As you saw, we did over 1,500 new tests just this past week.
Okay.
And actually more information about how we're expanding testing capacity for our county will be forthcoming. So look out for that, maybe tomorrow or the next day. The bottom line is, we're going to be responding to COVID-19 in our communities for a long time. Just expect that, and as we slowly open up, we will be living the new normal that, you talked about just now, where we still must practice the physical distancing, enhanced hand hygiene, with the 20-second good washing, and cough etiquette, where you cough into your elbow or into a tissue and then throw the tissue away. We have to do all of this until treatment is found or a vaccine is developed, and both of those are currently in the early stages.
Okay. So even though we are having lower numbers than the rest of the Bay Area counties, we're still in the early stages, and that's why we have to continue to do this. And we're not going to open up all at once. So I guess my next question is, how is public health going to ease restrictions?
So I want to, before we move on to that, just want to say that, I think the whole of California is slowly moving towards trying to ease these restrictions. And, regardless of when a community opens up, it should be slow, so that, and practicing the social distancing, physical distancing and hand hygiene that I mentioned is just as important after we start to open up. But the things that we have been focusing on in order to open up are, what we've been following the framework provided by the state of California to track how prepared we are to respond to COVID-19 as a measure of when we can open up. And on Thursday, April 30th, the governor issued new guidance in line with that announcement last night. We did start easing restrictions, and you may have gotten alert Solano if you live in Solano County here.
I did.
Just today at noon, like I did, that talked about how we are, going to open up and ease restrictions around the outdoor recreational activities. So people now can actually engage in non-contact recreational sports like golfing, boating, hiking, running, as long as they're able to maintain that 6-foot distancing that is so important.
Okay. And I don't know if swimming is considered a contact sport. Is that something that I can do?
Well, no, it's not a contact sport necessarily, but or not, but it isn't. It's still a little unsafe to do that right now, so we're going to hold off on the public swimming pools. However, contact sports should only be played with people in the same household.
Okay.
The other things that we're Solano Public Health has been working on is to create a roadmap so that businesses can reopen in a safe manner, and that will help reduce the risk and protect of opening up and protect our community. And we are still continuing to work with our hospital and healthcare partners to ensure that the healthcare system is able to meet the demand in case there is a surge after reopening some of these sectors.
Okay. So then Solano County will continue to ease the restrictions just like we did today by allowing, certain recreational activities, and more than anything, just remembering that, everyone, this is our new normal, and we all have to adapt to it. And it really is for ourselves, for our loved ones, and for our neighbors, for those that we may not know. So moving on to our health tip of the day. I know that last week we talked about youth, and I was wondering if this week we can talk about older adults and seniors.
Yeah, so for the past several weeks now, we've been talking about how older adults, seniors, are at higher risk for a bad outcome from COVID-19 if they're exposed. But in addition to that, there are also several things that seniors and our older adults are more prone to, and that we should all be aware of, so that we could be a good neighbor and help out if we can. So one of the things that the stay-at-home order has done is made it really hard for all of us to get preventive health care. And this is especially dangerous for those who have chronic health conditions, because poorly controlled high blood pressure, heart disease, and diabetes can lead to increased risk for heart attacks, strokes, and many other serious health conditions. And these, whenever, if that were to happen, it needs to be immediately treated. People need to call 911 as soon as they notice something, just because every second counts. Recently, there was a study that looked at how many 911 calls have been made in Solana County since the coronavirus pandemic started. And actually, those calls dropped 20 to 30% in our county.
Wow.
And the ambulance provider, Medic Ambulances for Solana County.
Mhm.
Do you know Jimmy
I do. I know that what he said this
Pearson?
week was.
Sorry, I couldn't remember his last name.
Yes, Jimmy Pearson. I know that this week he talked about how one of the reasons that they are thinking that less people are calling 911 is that they're scared that, especially older Americans, are scared that if they end up going to hospitals and to ambulances, they may end up getting sick. I don't know if you saw that, but one of the things that he reassured is that since COVID-19 has started, ambulances are cleaner than ever. They're
Yeah,
being.
yeah, they have a special way of cleaning the ambulances, which is I think they spray it with disinfectant.
Oh,
So it's and the other thing is, if there's concern that you're going to be getting COVID-19, if you were to go to the hospital, because that's where, COVID-19 patients are,
yeah.
don't worry because hospitals will keep you safe as well. And right now they're not overrun with coronavirus patients at all. In fact, when you saw the dashboard, you may recall, the capacity for hospitals remain good at this point, which means that there are over 31%, over 30% availability of those resources. Um,
And
Sorry, go ahead.
I just had a question. So, we know that less people are starting to call 911 and they may have this fear. Um, is our recommendation to not hesitate to go ahead and call if you have any symptoms? I know that in the
Yeah.
past we had talked about, FAST, and I can't remember what that stands for.
Okay. So yeah. So FAST is so we talked about the increased risk for heart attacks and strokes, right? So FAST actually stands for F is for face. So if when you're having a stroke, these are FAST are the is the mnemonic is the way that you can remember um, uh, things that you need to do or things that you should recognize as signs of potentially having a stroke.
Okay.
Okay, so FAST stands for face. So if there's any sort of facial drooping on one side or the other, A is for arms. If you have like uh, arm weakness on one side or the other, especially. S is for speech, so if you have a slurred speech, and then T is for timeliness. So as soon as you have remember the F, A, and S, you need to call 911, and that's so that you can get treated right away. And if you are seen quickly, shortly after
So, Dr. Wu, on my computer, it seems that we have frozen. I'm not sure if I also froze on your computer.
Jose, are you
Can you
still
hear me
there?
now? Yes.
Yeah.
Sorry, we froze for a
Okay.
bit.
Yeah, it looked like we were disconnected. Shall we continue, or what should we
Yes.
do? Okay. All right. So let's continue. So uh, I'm just gonna say, I know that the CNN has these technical difficulties too, so we're not, we're not unusual in having technical difficulties. But anyway, so those are symptoms of a stroke. But if you have chest pain, trouble breathing, those are also serious signs. And when in doubt, just call 911. They will help you decide whether or not you need to be rushed to the hospital.
Awesome. So don't hesitate. Call
Yeah.
911 and they will be able to direct you if it is that you need medical attention.
Yeah, and then I don't know if you want to talk about, how we've been talking about the mental health issues over the past couple weeks as well, which have affected um, uh, children, but also seniors are actually even more prone to mental health issues, especially loneliness.
Yeah.
And a recent survey actually showed that most seniors feel lonelier since the stay-at-home orders have been issued, and this might be due to them just being more isolated or less comfortable with technology that
Yeah.
younger people have been able to use to stay connected. So
So
we go ahead. Yeah.
we just want to make sure that everyone remembers that everyone can be a good neighbor. Everyone can go and check in on an older adult in their life. And if there is any type of concern that they may appear sick, that they are at risk of falling, um, low on food, need help with groceries, medical refills, or they suspect any type of elderly abuse, we have a number for older Americans. And this is the Older Adult Resource Line. And the number for that is 707 784 1607.
Yeah, and then I also saw on the Facebook page that we offer that EBT cards can now be used for online purchases on Amazon and Walmart,
Yes,
and
so
that way they
people
can get their groceries delivered, right?
Yes, so people can now get their groceries delivered through EBT, and they will come right through their door. I know that Amazon isn't available in every single area, but Walmart can definitely deliver to everyone, and we expect that as the program expands, that we will get other retailers to sign on. And people can find that information on our Facebook. As you know, that's at Solano PH. And if they have any doubts, they can always go to solanocounty.com/COVID-19. And we have resources, community resources, and that is categorized for older Americans, that is categorized for children. It also has links to our Facebook and all of the additional guidance that comes up anytime that we have a new shelter in place amendment or any type of additional guidance. That's where people can go and get updated.
Yes, thanks for that.
Thank you. Well, thank you so much for joining us again today for the weekly update. And I hope to see you next week. Same time,
Yeah.
same place.
Yes.
Cool.
Okay.
Thank you.
Bye.
Bye.